can
Okay.
confirm the webcast.
I'll wait for you to get back to me.
It has Councillor Mans and also Councillor Porter. I've just dialed her in because she was having trouble reaching the meeting, but she's with us now as well.
Oh, good. Excellent. Can we have apologies for absence? No apologies.
No apologies.
Councillor Mans, Graham Allen is unable to attend today. He's on leave, but I'm deputising from an adults health and care perspective.
Right. Who's that? Sorry.
Jess Hutchinson.
Oh, yes. Right. Fine. Declarations of interest. Have anyone got any declaration of interest under the appropriate paragraph headings? Okay. Moving on to item 3, minutes of the previous meeting. Have you all had a chance to look at those, and are you happy with them? Is there anything you want changing? Okay, let's approve those then. Get back to the agenda. There we are. And next we've got deputations. Councillor Porter, I understand you're with us.
Yes, thank you, I am.
Just in time. Good planning, just in time.
It turned out that we had a problem with Teams and Edge and all sorts of things, but I think we've managed to solve it now, so thank you.
I understand exactly how you feel. I've been going through precisely the same issue in the last day or two.
Agony. Okay, my concern about obviously the outbreak is the outbreak board has got a situation where we've got getting locked down on Thursday, and my concern is about schools and the way in which children can access schools, and parents that are looking towards schools for the future are finding a disparity in what the schools are offering to the parents as about visits and the way in which a school operates, and importantly meeting the head as children and staff within it. And it's fine if you have a child that's already at a school and you're just encouraging a second child to go to the same one, but the disparity is quite marked between other schools and even places where parents would probably, they may even be in the same catchment, so it's making it very difficult for those parents. I wondered if the Department of Director of Public Health, because we're having settings that are encouraging, nursery settings encouraging people to go and visit, but schools are not in some cases and are in others, and independent schools are encouraging people to visit. And I wondered if that has changed at all during lockdown, and can anybody give me some firm advice, or is the County Council going to be issuing firm advice to schools as a result of this?
Is that it, Jackie?
That's it. I was going to raise school meals, but I'm sure you'll be discussing that at some stage.
Yes, we'll probably be discussing that tomorrow, I think. Councillor Stallard, could you take that one on board? And if I could leave you and Councillor Chad to discuss with Councillor Porter offline as to exactly what the position is, because we haven't got a position. I haven't got one that I know about myself, and obviously take the advice of the Director of Public Health that may have something further to say about that, if he knows anything further when he speaks later. Okay.
Yeah, I will certainly do that. Unfortunately, when she was speaking, Councillor Porter frequently broke up the audio, and I really wasn't able to make a lot of what she was saying. So perhaps, if you don't mind, Councillor Porter, I do apologise, but if it would be possible for you to send me an email setting out what your concerns are, because I'm afraid I couldn't hear it very clearly over this link.
Okay, Councillor Porter, you happy with that? I think we've lost you again.
I'll send her an email and we'll pick it up from there.
Okay,
Yeah,
thank you very much.
She does have quite a few problems with her broadband, so I
understand that.
Meeting over the weekend.
Okay, right. Moving on, Chairman's opening remarks. I don't have a lot to say other than what's already in the Director of Public Health report. But I think I'd say two things. First of all, clearly the situation's changed quite radically over the weekend in terms of the latest scientific and medical advice and various other matters. So effectively from Thursday, we're all in the higher tier plus, I think would be the way of describing it. Just as a matter of interest, our positive test rate per 100,000 is 110 at the last count, which is exactly the same as the rest of the southeast. The northwest is 431 and England is 228. I think the other thing I'd say is that it's all rising pretty rapidly, and increasingly the districts were moving together. In other words, outliers at the top, such as Rushmore, have slowed down, and outliers at the bottom, such as Gosport, have speeded up. So the gap between the top and the bottom is much narrower than it was 2 or 3 weeks ago. We will obviously continue with the meeting we've got with districts, and I think the unitaries, if my memory serves me correctly, tomorrow afternoon. I think it's 5 o'clock, isn't it? And indeed, I would argue, as I mentioned to Councillor House in an email, I think probably that's even more necessary than it was before, because I think it's vitally important that we try to ensure that everything we do now, as much as it's under our control, is focused on getting the R rate down lower, preferably below 1, but certainly down to a level together with the other statistics, one of which I've mentioned just now, to a point where we can get out of the newly imposed lockdown in time for the majority of December. And as I understand it, although it's a bit vague at the moment, the idea is that if you reach a particular level, and we don't know what that is, you'll be able to go back to a more regional way of looking at things. So we've got a real aim there, I think, in Hampshire, and indeed I'd argue in the unitary authorities, to do everything we possibly can in the next 4 weeks to get the level down to one where we then have more control over what we do. And I think the only other point that I'll cover now that we probably discuss, or we can discuss it now, get it out of the way, is the regular, the times we hold the meetings. I think I'm coming round to the point of view, but I'm quite happy to take views on this, that we maintain our present arrangement, but we crank up the briefings, because I think that is a way of very rapidly responding to things, rather than going through the more formalized process of having a public meeting. If we want to, of course, we can put some of our own proceedings that we have as briefings into the public domain at the time we have them, if we wish to do so. My worry is if we increase the actual programmed meetings, we do run into issues about, by the time we actually have the meeting, bearing in mind the 5 days in the public domain, the situation could well have changed. I'm not against doing that more often, but I just think we need to actually look at what we're trying to do, which is to have briefings and meetings as often as possible, commensurate with the state of the pandemic. Judith, you brought the subject up. What's your view?
Yes,
Judith.
Thank you, Leader. Yes, I did write to you last night about this, because our next scheduled meeting is not until I think 15th of December, which is after the December the 2nd. I was going to say when lockdown ends, but I'll say after December the 2nd. And whilst we are all receiving briefings and a lot of information is being put in the public domain through comms and so on, this is the only dedicated meeting to deal with outbreaks that's held in the public domain. And therefore, I thought that perhaps we should just on this one occasion, well, at the moment, schedule another meeting for perhaps the third week in November to assess where we are and what things are looking like, and so that the public can see also our deliberations at that stage.
Councillor House.
Yes, thank you very much, Chairman. And I totally agree with Judith Kreski on that. I think transparency really matters on this issue, and being seen to be accountable and held to account is really, really important. Reassurance is the most important thing we can do in many ways as elected members, and we can do that by being transparent and open about what we're doing as organisations. I think the couple of email exchanges we've had over the last week reflect your point also, that information sharing and consolidation with the districts and the 2 unitaries is really important. And it was thinking through the issues about what would happen if we went to different levels of lockdown in terms of the tiers, that really brought out to me the importance of making sure that we have a properly joined up approach. Firstly, with the districts, so they know what's going on, because there are huge variations between the districts in terms of infection levels, although you rightly pointed out that trends are going in both directions at the moment in different areas, but also the relationship with the 2 unitaries. I know that from where I sit on the south coast, within a couple of miles of the city border of Southampton, and a lot of councillors who sit close to the Portsmouth border, that what happens in those places matters as much as what happens in many other parts of our county, because the relationships are so pivotal. The travel to work areas are significant. The leisure activity areas, when that's allowed to happen, are very significant. So that degree of informal discussion and linking up with what's going on, as we're planning to have tomorrow afternoon, I think is really important, and we could probably do with more of those.
Okay, anyone else got any other views? Well, look, I think what we might do then is at the next briefing, when have we got the next briefing? Well, we can have them when we like. I would suggest we have another briefing in a week at the beginning of next week, bearing in mind we'll then have a pretty clear idea of what the new arrangements are. And I'm not against having a meeting before December the 2nd, either in the 3rd or 4th week of this month. And it may be we can make that into the December meeting and see how it goes. I'm quite happy to do that for the sake of transparency. What I don't want to do is just have a meeting for the sake of having it. Because I do make the point that the information that we have, that we've put in the public domain for a particular meeting, may be out of date by the time we have it. So probably what I'd say is the 4th week of December, because then we should be in as good a position as we're going to be to see what the situation is going to be like on the 2nd of December. So I'm very happy to go along with that. So what we'll do is we'll arrange to have another meeting at the end of November, and then we can decide then whether we want one before Christmas, or perhaps have another one after Christmas, something like that. Your Councillor House, your point about the unitaries is well made. I have a regular monthly meeting with the 3 leaders. And indeed, we added Bournemouth to our list last time round, largely because, rather like you, there's a lot of people living in my part of the New Forest who are very interested in what's happening. Like the border of my division is right just almost to the west of Highcliffe. Such is the way they decided the original split between Dorset and Hampshire way back in whenever it was 1974. So you make a good point, and I certainly would hope that we can work very closely with the unitaries to the south of us, because you're absolutely right. For people on the ground, whether they're just in Eastleigh or just in Southampton is immaterial. They want to know exactly what they want to do. John Coghlan.
Yeah, thank you, Chairman, and sorry for interrupting the discussion. I completely agree with everything that's been said, and we'll certainly make arrangements for a formal meeting. I think you said in the last week of December, but meant the last week of November. So we'll do that. We'll keep the existing date.
Sorry, yes.
We'll keep the existing date in December in place, but we'll work it as we go, because we can be flexible with these arrangements, especially the briefings, but including the formal meetings. I do think your point is the right one, though, that we have to be careful with the pace of travel. With the formal meetings, we're publishing papers in advance, and that can be a bit clumsy for the sort of pace that we're talking about. I would also, if I may, Chairman, just make a technical point with regard to the meeting tomorrow with the districts and the county, to which we've also properly, for the reasons discussed, invited the unitaries. There's a core purpose of that meeting, which is between the Public Health Authority and the attendant bodies within the county, which obviously is very helpful to have our partners in the LRF present for that. And I'm sure the conversation will flow naturally, but I just think making that technical point. The other challenge that we've got within all of this is, of course, apart from the LRF borders, the County Council has 8 other boundaries with 8 other public health authorities. So it becomes a complicated picture whichever way we look at it. But I've got the message about the arrangements for the meetings. Thank you, Chairman.
Okay, well, look, that's all I've got in my opening remarks. So can we move straight on to item 6, which is the Outbreak Control Position Report, which I think is going to be given by our Director of Public Health. Simon, over to you. Microphone, Simon.
Is that working now?
Perfect.
Brilliant. So I'll give you a presentation on the update on the data, and I can respond to some of the questions posed by Councillor Porter and others in my next item around the actions I'm taking, which I think will assure you. So this data is around the week beginning the 2nd of November, so very up to date. As you know, the data has some lag, but worth just going through. And as Councillor Manns has talked through the data, so we'll look at the number of cases and rates as you are used to in this presentation, and the deaths, just to kind of keep us up to date with how the pandemic is moving forward. It's also worth saying this presentation is put together and has not been affected anything by lockdown, because we're showing the picture of the information within Hampshire. So you can see this graph here, which shows the epidemic curve, and quite rightly, the leader pointed out to me earlier on, we should put a line on the 14th of July in the middle of that graph, because the testing regime changed. So we know in the first wave, it was just pillar 1 testing. So that was people who were admitted to hospital or living or working in a health or care environment. Whereas now we have pillar 2 testing, and you'll recall that it has been challenged in terms of lab capacity. We're in a much better position, and you can see the number of cases on the right hand side of that graph going up. Bearing in mind the last few days is a bit of a lag, so we're really mindful of those. But we're seeing that increase, and we're seeing quite a sharp increase in cases. So in the last week, we've had 1,526 new cases of coronavirus tested and diagnosed within Hampshire. That's a rate of 110.4. Just to reiterate what the leader said earlier, that compares to the southeast of 110.2, the northwest of 431.4, and the England 7-day rate of 228.1. So we can see there that we're in line with the southeast, and that's obviously of concern, because the rates are going up. With regards to our district rates, now this apologies. This graph shows the epidemic curve from the beginning, and it does show that over the whole pandemic, Rushmore has had the most number of cases per 100,000 across the whole pandemic. And then when you look at our weekly rate again, that really important figure to show where it's going, we can see that those rates across the district have kind of come together in terms of the spread of rate per 100,000 isn't as great as it was. So some areas are around 135 per 100,000, and Eastleigh at 152. And then we have areas at the bottom end of East Hampshire, 82.6. I think it's just worth saying as we talk about this, that actually because of the smaller geography of these patches, the rates do go up and down over the weeks and the days. So it's basically, we need to really grasp in this board that the rates are going up, and they're going up quite steeply everywhere. There's no particular area that stands out as having a sharper increase, but as I said, it does go up and down. And we know that Test and Trace is tracking those people. So when we look at this map,
Could I just interrupt at that point? Sorry to interrupt you, Simon, but when I looked at that graph, I find it extremely difficult to identify, for example, Havant as opposed to Basingstoke-on-Dean as opposed to Winchester, because maybe I'm colourblind, but the colours are very similar and they got lost in a tangle of colours. Can you, just for my own personal information, can you tell me where Winchester is on that network of colours and lines on the graph?
Yeah, so Winchester's this one here, this kind of.
Sorry, which one?
It's, I don't know if you see my arrow. It's 1, 2, 3, 4, the 5th one down.
Thank you.
I think what would be helpful, Samaya, if I can, and Chairman, with your permission, if I share the district rates after this meeting in a tabular form, because that would be really helpful just to share around.
That would be very helpful. Thank you very much. Thank you.
And as I say, this shows the kind of across the pandemic. And it's just really helpful to see that, because that does show the number of people affected in each district, which is important. The thing that we need to be mindful of now is which district is impacted, and kind of by what measure.
Apologies, Simon. Can I just jump in there
of
as
course.
well? On a similar point to Patricia's, for those of us who know we're colourblind, and I definitely am colourblind, it's really helpful with these kind of charts. If the key on the left-hand side is in the same order as the current right-hand peak of each thing, so England at the top, then Rushmore, then Basingstoke, as opposed to alphabetical. If that can be done, that would make life an awful lot easier.
Slightly more challenging, but I'll see what I can do, Councillor.
Thank you.
But yes, I agree, and I wonder if a 7-day rate graph might be more useful, so I'll pick that up with the team. These two maps, week 42 and week 43, show where we are, and you can see that dark red patch increasing. So those areas with over 335 per 100,000 on the right hand side, you can see that kind of darker orange coming down, and you can see the other areas. So I think from these you can take that actually the number of cases are increasing, and as you can see, we need to take action across that. The number of green and even blue areas are disappearing fast, with our colleagues in the Isle of Wight doing particularly well in terms of rates, but the darker orange and the red increasing, and that's where we've seen the change in the guidance, and then we've moved into a national lockdown coming on at 1 minute past midnight on Thursday. Finally, it's really worth talking about deaths. So the latest deaths, we've seen 4 deaths from COVID. The latest week figure, bearing in mind that we have to, that's a bit of a lag. And we know that we're below the excess death rate, and we need to, as we've always said, monitor that on a longer period of time. But I think it's really important to note the deaths, because I think as we see the number of cases going up, there is always a lag of 2 to 3 weeks in terms of the number of deaths. So we will see that sadly go up as well, and we want to keep an eye on that. So those are the figures that I really wanted to share with you today. As I said, I will share those district rates with you going forward. It's worth saying prior to the national lockdown, they were looking at different data criteria to review. So we are reviewing very carefully our rates, our 7-day rates I've shared with you. Our rate in the over 60s, because we know those people were more affected by COVID and may more likely to need hospitalisations, and also our 7-day positivity rate. So the number of people testing positive for coronavirus out of the number of people being tested. And if we see more of that, we get more concerned. Within Hampshire, we have been doing very well on all those indicators. Obviously, they're going up, and that's of a concern. However, we haven't had any area be of major concern to put us on the national watch list or anything like that. And I think that's testament to all the work we're doing and the leadership we're providing with this board to take forward all the COVID actions to prevent spread and to reduce hospital admissions. Councillor Mans, I'll stop there and happy to take any questions.
Thank you very much, Simon. Councillor Steller, Patricia.
Thank you very much. Very interesting, Simon. Very interesting indeed. At one point, it can seem to be fairly depressing in as much as the numbers are rising quite significantly, as you said. But if you notice in one of your graphs, the excess deaths graph, it's noticeable that the excess deaths continue to be lower than the 5-year weekly average. So, you know, that's a significant point to make.
So absolutely, Councillor, I absolutely agree with you. It's really positive. I think what we've seen, though, in the April peak was those excess deaths being much higher. So actually what we need to do is monitor excess deaths over a much longer period of time. What we don't know at this point in time is if we, and I say it very sensitively, if those deaths were brought forward by a few months, or indeed they weren't likely to happen in this time period. At this point in time, we're very positive, and that's really, really good. But I think we can see back in April, there was a huge number of excess deaths, not just from COVID, but from other illnesses, which is why it's really important that the NHS really ensures that people know it's still open for any kind of business, including COVID. And I think we need to support our residents to access the right healthcare in the right way and at the right time.
Maybe I could ask Keith, the chairman, the leader, how might we, given that what Simon has just said about, you know, we need to give NHS whatever support we can to promote the figures and to do what we can to reduce this. What could we do? Have you any ideas? Have we any thoughts on that? Either Simon or Keith?
What do you mean, to reduce the number of deaths?
Well, to give the NHS the kind of support that Simon referred to.
So Councillor Mann, shall I come in there? Would that be helpful?
Yes.
So you're absolutely right, and we're working really closely with the NHS to ensure a couple of things. One, I'm part of the Restoration and Recovery Executive for the NHS to, as they stand up the NHS, to make sure they stand the right things up at the right time, because what we don't want is the NHS to kind of provide the services that may be less urgent. I know that might mean people need to wait for certain types of procedures, but actually what we want them to do is to be open for things like heart attacks, urgent cancers, etc. So that's really important. We're doing that work. Furthermore, my team has done a piece of work with primary care services to support them to what's the right word? To focus on those people who may be more at risk from the ill effects of COVID. So those people with excess weight, those people from a BME population. So actually we're doing a lot of work to help them focus their services in the right way so that the right people get the services at the right time. And then finally, we are communicating with the NHS around some of those messages.
Yeah, since you asked me that question, I better give you some form of reply as well, Patricia. I think also in addition, the fact that we've got these 3 step-down units across the county, which are taking patients that can legitimately move out of acute care facilities at our main hospitals much more quickly than we were even doing prior to the pandemic, means that that is releasing beds. Because as I understand it, in many cases, the pressure isn't so much on the number of beds, but increasingly, particularly if the Nightingale hospitals have to be used, it will be the staffing issue within the NHS. And therefore, if we're actually releasing some of the beds in existing hospitals into our step-down units for re-enablement, that should mean that more staff are available to deal with COVID-19 patients. But I've got a few other people that come on board now. John Coghlan.
Yeah, thank you, Chairman. You've covered one of the points I wanted to make. The increase in discharge to assessed beds, I know, has been hugely appreciated by the hospitals, and that's been a fantastic, very quick piece of work, which is going to take enormous pressure, so that and also is a great service to patients, because it means they can be removed from the hospital setting while their future needs are addressed. And I think the latest figure I saw was that 70% of the patients in discharge to assessed beds were getting back home, which is a fantastic achievement for the system as well as for the individuals. But the other dimension to this, and I'm sure Jess Hutchinson will comment further on it, is the quality of the work that we do to prevent other residents of the county needing hospital care, and to make sure our preventative support systems are well in place makes a huge difference to our NHS colleagues as well. And the work around the primary care teams, work in the primary care teams around the county, is a huge addition to the support we offer to them. But Jess knows more about this than I do, Chairman.
Jess, would you like to comment further?
Yes, thank you, Chairman. Just to say that in addition to looking really carefully at how we continue to support adult health and care services across the board, whether it's looking at care homes, day services, domiciliary care, and what lockdown might mean in those scenarios, we are also supporting the broader group with an introduction of additional support for those who are extremely clinically vulnerable. So you may remember this is the group of people that have been particularly identified, some 52,000 people in Hampshire who are particularly clinically vulnerable, and we will be supporting the coronavirus helpline to provide support for people to not need to go to, for example, to pharmacies if they have no friends and family. Volunteers will support with some of those kind of tasks, so people will be able to stay at home and stay well. So real wide range of preventative actions, I think, that will directly and indirectly support the NHS.
Thanks, Jess. Judy, you had a point.
Yes, thank you very much, Leader. I just wanted to check with Simon. I wanted to firstly say I was really impressed. I was looking at the COVID-19 communications summary. I'm really impressed with all the work that you are doing. But just picking up a point Simon made about the encouragement of people to access healthcare if they need it, not like the last pandemic when we know that people didn't. I know the NHS is doing a lot of promotion on that, but is there any joint work involving Hampshire to promote that? Because some people get their information in different ways. I just wanted to check, Simon, whether in the COVID-19 communications from Hampshire, we're reinforcing those kind of messages.
I have to admit, in our last 2 weeks, our comms messages have been much more aligned, and that's really good. I can't say for certain that we have promoted the NHS message, but I think we have. I will take that away to make sure we fully line that up. And I think what I'm really pleased about is the NHS providers are, on the screens they're having reception, are promoting the same messages, and the cartoons that the animations that we've developed. So that's really positive. So we'll pick that up, Judy, and take that away.
Thank you, because I think it will be very powerful that the public, wherever they read it, they read the same messages from Hampshire County Council and ourselves and the districts, etc. Thank you.
Yes, I entirely agree with that last point. I think the message I was giving out at the beginning of the pandemic was our objective is to reduce the spread of the virus. We must do that working together, both in the public and private sector, and we must support each other.
Yes, absolutely.
And we've stuck to that since March. And it's a clear message, because I have to say, without in any way criticising the present government, you would not expect me to do that, but there has been a tendency to try to modify the messages every few weeks. I always look at what's on the front of the lecterns, and I think now it's about right, but I think that a clear message, three things seems to be the fashion at the moment, is the right way forward. Because otherwise, you're absolutely right, people it's confusing enough without making it more so.
Thank you, and thank you, Simon.
Simon, did you have something?
Can I just say I've had a quick confirmation from our comms team that absolutely we are aligned and everything's done together. So thank you to the comms people who are clearly listening. Apologies, I couldn't have quicker answer.
No, don't worry. And I just think it's important we can record that, as the leader has said. Thank you.
And I'm very impressed with how quickly we got an answer to that question. Very good. Right. OK. Is that all on item 6? Let us move on to item 7. And Simon, you remain in the chair.
Many thanks.
Councillor Mans, can we take the recommendation, please, for item 6?
Oh, I do apologise. Yes, of course.
That's all right.
Thank you for reminding me. Yes, the recommendation at item 6 is to note the current data and implications. We're all happy with that, unless you put your hand up. I assume you are. Okay. I should have said at the beginning, we'll use that method of voting rather than go through a rather laborious positive way. If in any of the recommendations you are unhappy with, you put your hand up and then we hear what you have to say and then we can vote accordingly. Okay. Thank you, Samara, for keeping me up to date. Moving on to item 7, which is an oral report, isn't it?
Many thanks, Leader. If I can give you an oral update of some of the actions that we have been taking over the last period of time, bearing in mind that we have had a national lockdown announced on Saturday evening to come in on Thursday. I still think it's very relevant to update the board on actions that have occurred and how we're planning that. It's worth saying when looking at that high level data, we look at all the particular settings and places that these take place. Most of the spread is within communities and within households rather than any particular settings, workplaces, etc. So we've been dealing, however, we've been dealing with a number of outbreaks, whether they be small or slightly larger, to manage that, supporting the settings to take the correct action to prevent spread. You'll have seen there be a small number of outbreaks in schools. There continues to be a small number in care homes and very few in workplaces, but we're working with those settings to manage either individual cases or, as I say, small outbreaks. It's worth saying that however small the outbreak or cases is, it does take a significant amount of time to make sure everything's in line, and some of the settings are quite complicated to manage, and some settings require some clear kind of actions by the setting. We're working well with every single setting that required that. It's just worth highlighting over the last few weeks that actually schools have been busy because every single case requires us to take some kind of action to support the school or educational setting to close a bubble, isolate a member of staff, or take other action. I'm really pleased the schools work very well with us. The Department for Education helpline has rapidly improved over the last, since it had a few teething issues in the first couple of days, it's really supported now, and that's working very, very well. And I think we're finding that schools are responding well. And we do that in absolutely hand in glove with Children's Services and Councillor Stallard's colleagues and executive directors there. So that's been really, really positive. But it's time consuming. We have a number of schools to deal with. With regard to events, so we've been doing a lot of work to understand what events might be taking place in the next time period and to support them either to be COVID safe or to maybe not go ahead if they're not. That takes a lot of work. We've issued, and I think we updated last time, we issued some really clear communications on Halloween, and you'll see the animation on social media. And again, thinking about bonfire nights and then Remembrance Day. Some of these have been a bit overtaken by the national lockdown. However, it's worth saying we were preparing locally for managing that. And I think the advice and guidance we gave out was very well received and very clear. So I'm really pleased about that. With regards to the unitaries and our neighbours, we work incredibly closely with both the unitaries in within the Hampshire and Isle of Wight LRF. Obviously, I can working with the Isle of Wight is under my jurisdiction as well, so that's working well. But I equally work as well with Southampton and Portsmouth, and my colleagues across all borders. Should there be an issue that we need to deal with together, whether that be an outbreak or managing an event that crosses borders. We do that really well. I think my communication with my colleagues and neighbours is very strong, and I work across colleagues in the southeast and then of course in Dorset and Wiltshire to promote that. So I think I'd just like to assure the board that despite us having a boundary, which is really important to remember that, people and issues and events and viruses don't just stop at boundaries, so I work across all areas. Finally, I'd just like to update you on testing. We have increased our local testing sites. We've opened up 5 within the Hampshire boundary, and that's really positive. And equally, we're looking at opening some others, subject to Department of Health and Social Care and Deloitte for working through those. And they are the walk-in sites, so obviously you can drive to the walk-in site and then get out and walk through, and that does increase access. And as I said previously, the lab capacity is increased, so we're now seeing that actually there is really good access to testing across the county. And you may recall the regional testing site is now based at Southampton Airport and equally is accessible, and that's the drive-through, so you sit in your car and get a test. And taking feedback from people about how that's working and whether we need to make any slight adjustments to those. On Saturday evening, the Prime Minister announced something called lateral flow testing, which is a test that people can take themselves, and that speeds up testing. We need to just balance that with the need for accuracy and the situation. So we are working with government again to make sure that we can have access to that as soon as possible to use in the appropriate situations for that. That would be different to if someone has symptoms, because they can go and get a test in a testing centre, but it might be for a particular setting we require that. So we are working with that, and we are working with national government to ensure we can have that test locally. And there's other tests being piloted locally as well by hospitals and universities, and we're working closely with them to make sure that Hampshire has the best access to all variety of testing that it may require to manage the pandemic. I'm really pleased that the way that we are, well, we as in partners are leading the way of improving our access to testing and then results. In the main, results are coming back within 24 hours, and that's what we'd like to see. We need to see that test results come back quicker. Now we've increased the lab capacity, we need to increase the speed, and that is improving. There are obviously blips, and some people don't get test results in the timeliness we would like. In the main, it's improving, and we're keeping a strong eye on that with the regional team. I think from my perspective, Councillor Manns, that's my verbal update. Again, happy to take any questions.
Thank you very much, Simon. Questions? Patricia.
Thank you, Keith. It's not really a question, it's more of a little bit more information about what Simon was talking about the schools. I thought that people at this virtual meeting this afternoon might like to know that some more little background on the schools and the numbers. We've got about 534 schools in Hampshire, and since September, since the term started, in total we've had 133 cases and of those 133 cases we've actually had to close down 101 bubbles. Now a bubble could be a class or just a small group, but since in October, of those 133 cases that we've had, in October we had 114 cases, so 114 of those cases took place in October. So you can see there was, as Simon has already said, quite a significant rise there. I've got a note that Rushmore area continues to be not the best area to be, but I think Simon said it was levelling off. I think you said earlier this afternoon it was levelling off. We've got 26 special schools, and 4 of those so far have got some level of infection. Now, clearly, from my point of view, that's a little bit worrying, because they're special schools and the young children in there are usually very sensitive and very vulnerable. So we're keeping an eye on that in particular. All our schools have got test kits available to them, but we're getting feedback, Simon, and I'd like you to comment on this. We are getting feedback from the schools to say it's taking, they can do the test, but it's taking 5 to 6 days still, as of last week, to get the results back. And that's having a knock-on effect because people don't isolate until they get the results back. So I'd like to have your comments on that and what we can do to improve that.
Simon.
Many thanks, Councillor Stallard. You're absolutely right that schools do have a limited number of testing to use in an emergency situation. We do know postal tests take a bit of time because they've got to go in the post and that takes time. It's better for people to, if possible, to go to a local test centre and only use the school kits if they can't get there for some reason. If a parent is very unlikely to get their child who's positive or has symptoms to a test centre. It's also worth saying if someone has positive symptoms, whether or not they've tested positive, if they've got the symptoms of a cough, a high temperature and or loss of smell, they should be isolating straight away. So we don't wait for the result. What that might mean is the contacts don't isolate straight away whilst they're waiting for the result. So I can again pick up with Children's Services to make sure that schools, and we communicate frequently with schools, are following the best process to get people tested quickly. But I think it's just worth reiterating here, if you've got positive symptoms for coronavirus, whether or not you've got a positive test at this point, you should isolate and then wait for your test. If you're tested negative, you come out of isolation. If you're tested positive, you stay in isolation.
Thank you. Ken Rattigan. Welcome, Ken.
Yes, thank you, Keith. Just quickly, Simon, if I may, the Anvil Walkthrough Centre has been fairly successful in its start-up, but it has capacity for over 800 tests in a day. Now, I know the numbers are very small going through that. Is there a possibility at some point in the future that key workers could use some of those slots in some sort of organised way? It does seem to me that there's a facility there, it's ready, it's capable, and yet it's not being used to its full capacity. Have you any thoughts on that?
Yeah, thanks very much, Councillor Rattigan. I think there's a couple of things to say, and I'm really pleased with the way that the testing centres have been set up. And yes, they have much greater capacity. At the minute, I'm very pleased that that's not needed, because as the pandemic spreads, we will need more of that capacity to test people, to isolate. I'm not quite sure if you were saying this, but I'll just be really clear. If someone needs a test because they have symptoms, they should go and get a test. If someone is a contact of someone who is positive, having a test doesn't stop them isolating. I think there's a slight misunderstanding about that. So if someone needs, so we need to be clear why we're testing somebody, and equally a test in someone who is symptomatic is likely to be more accurate than someone who is asymptomatic. So if we need to test key workers, and there are programmes, so we know that Hampshire Hospitals has tested all its staff due to a situation, it's not recommended currently to do a whole kind of setting or system test. Should that be required, we'll be working through the various test programmes we have to arrange that. And then if need be, we use the places like the Anvil. What we don't really want is people who are asymptomatic going to somewhere where they might actually catch it because of the situation. But yeah, I can understand that.
Okay, have we got any other points on this particular item? We don't have any recommendations for this one, do we? So we can move straight on to item 8, which is communications. Judith, I think you are going to perform on this occasion to give Simon a bit of a rest.
Yes, that's right. Yes. Most of my report relates to the 4-week period up to the 20th of October, so it's a little out of date now, but I will come right up to date with 1 or 2 other pieces of information that are not on your agenda. We are continuing with the two-stranded approach to communications, which I explained at the last meeting. That's up-to-date information about what's happening now, and also the Keep Safe guidance with even more social media posts than last time. So if we look at the left-hand side of the page that you've got in the agenda, you can see a summary of the key communications and highlights. Engagement with the public remains high, and targeted campaigns, which I explained about those last time, they've continued. We've also made new videos on self-isolating and some new animations, which Simon referred to earlier. Now, since our last meeting, the government has introduced, or it did introduce, the tier system, and our comms department were cascading down national messaging and sharing national graphics as well. So this refresh of messaging has ensured that engagement has remained high, with the data dashboard being the most successful post. In September, we reached 630,000 people, you may remember, but in the last 4 weeks up to the 20th of October, we've reached 950,000. So quite a big increase there. And I think that shows that the constant refresh of messaging is working. But at the same time, I'd like to pick up on something that Judy Gillis said earlier. It's about getting, I think this is what she was saying, it's about getting the branding right. So we're all singing from the same song sheet. And yes, I'd very much like to thank the districts and our partners for cascading down the information to get this continuity of branding going. You know, branding's important, not just when you're selling baked beans, but also when you're trying to do any kind of messaging that you want the public, where you want the public to retain the information. So moving to the centre section, there have been more media enquiries handled, 80 up from 76, and the number of news items covering the COVID pandemic it has gone up from 101 to 141, and 97% of that coverage has been positive or neutral. The key areas of enquiry that we've been experiencing have been around schools and care homes. And as you might expect, there's also been interest in seasonal events such as Halloween, which thankfully has now passed, and Guy Fawkes Night, which will soon be behind us, and then looking a bit further ahead to Diwali and Christmas. Last week, we saw more press releases on specific events, and additional advice was also given out for the vulnerable and those who had been shielding earlier in the year. So some extra advice for those people. This weekend, we've had the lockdown announcement, and I'd like to reassure board members that the comms messaging for this is well underway, because we've continued to prepare messaging for whatever change in circumstances might come. So we're ready to push the button on things. Moving to the right-hand side of the page, targeted support for high risk settings has continued. We've had many enquiries from schools, and county councillors are being kept up to date with outbreaks in their own divisions and also via the school's website, but always ensuring that individual anonymity of cases is protected. There's going to be a follow-up webinar with schools to reinforce processes. You may recall that some webinars were done early on in September, and as I say, there's more planned to reinforce things. And working with the health protection team, schools have been provided with template letters to assist their own communications with parents and the community. Guidance is being provided around playground etiquette, producing school posters, and also we've been providing information for school newsletters. There's been significant activity around adult social care, and we've been working collaboratively with the NHS on this. So there's now on the website a one-stop shop for adult social care, which pulls together all of the information in one place. That provides the information which can be accessed by the 2,000 or so care homes, providers of domiciliary care and supported living. And in addition, there's a fortnightly newsletter being sent out. And finally, we are now ready to move forward immediately with high-profile messaging, both general and targeted, for the lockdown period, and have additional staff to deal with the anticipated increase in demand for information, always working with the NHS, the Local Resilience Forum and key partners. Thank you.
Thank you very much, Judith. Have you got any questions at all? I think the one thing I would say is that we're clearly going to get more questions from the public as to exactly what the new rules are. I note that, as far as I can see, the Secretary of State has encouraged us, as he puts it, to keep the recycling centres open. I'm not quite certain what that means. Presumably, it means that they're part of essential services, because that's what's important in order to actually abide by the legislation that's going to be passed by the government on Wednesday. I always feel that there's a degree of vagueness in some of these statements that just confuses rather than helps. So there's a number of other things that are clearly going to happen. I think there's been a temporary ban on eviction, other than mortgage, temporary ban on evictions and a mortgage holiday as well to be extended. So I think what we've got to do is ensure that we are up to speed with the latest information provided to us by the government, so we can pass that on quickly and people actually understand what the position is, because I suspect as a result of the different tiers during the summer, different information coming out from different areas, that there is not the same clarity in people's minds that there perhaps was in the spring as to what you can and cannot do.
I think you're absolutely right, Keith. If I can just say, I mean, this morning I went rushing out at Upper State to pick up my winter duvet from the dry cleaners before Wednesday, and they were told that they're actually going to be allowed to stay open, although they probably won't, because people don't want dry cleaning anymore. So, you know, and I was quite surprised that dry cleaners and so on are going to be allowed to stay open.
And I understand the garden centres are going to be allowed to stay open as well. Whether we're going to go down the Welsh route, sort of masking various sections of shops off and getting it wrong, I don't know. But I think these are the sorts of things we'll need to just press government to ensure we have as much clarity as possible, so that we can pass that information on to individuals. Because having done so, I think then we've got the best chance of getting their support to ensure that the rules that do apply are actually abided by, so that we can get out of this latest lockdown as quickly as possible. Has anyone got anything else? John, do you have anything to add at all before we finish?
No, thank you, Chairman, other than to assure members of our continued determination to work as transparently and as effectively as we possibly can, and also to pass on our thanks to all members of this board, from the senior officers, for the clear support and guidance we're getting through this arrangement. It's really, really helpful. Thank you very much.
Thank you, John. Okay, right. Well, thank you all very much. We'll meet again before the end of the month, and we'll undoubtedly have some briefing sessions before that, because it's very clear that this is a fast-moving, as we've discovered over the last week, fairly fast-moving situation, and I don't think it's going to slow up at all during the next few weeks. Thank you all very much.
Thank you.
Bye.
Thank you.
Bye, everybody.
Bye.